My name is Samantha Pravat. I'm a registered nurse and I'm the gastrointestinal nurse navigator at Gibbs Cancer Center. I work with patients who have been diagnosed with a cancer within the gastrointestinal system. Some of those sites include the liver, esophagus, pancreas, and most commonly the colon or rectum. A cancer diagnosis is very overwhelming for patients. My job is to help them understand and sort through all of the information they receive at the time of diagnosis. I also help eliminate any barriers to treatment, such as transportation issues or financial concerns. The first screening option for colorectal cancer is a colonoscopy. This is the best way to check for what's going on in your colon. A colonoscopy is done in the hospital. They put you to sleep and they insert a small tube into your rectum with a tiny camera on the end. This allows the doctor to see the inside of the colon and to biopsy any abnormalities that they may find. One abnormality that may be found at the time of colonoscopy is a polyp. A polyp is a clump of abnormal cells that could potentially turn into cancer. A second screening option for colorectal cancer is a fecal immunochemical test, or a FIT test. This allows the patient to provide a stool sample from the comfort of their own home, which will be checked for blood. Blood in the stool does not necessarily mean that there's cancer. It could come from other causes such as hemorrhoids or ulcers or tears. So if a FIT test is positive, a patient would then need to have a colonoscopy. The American Cancer Society recommends that people who are at average risk for colorectal cancer begin screening at age 45. People are at average risk if they do not have a personal history of colorectal cancer or certain types of polyps, a family history of colorectal cancer, a personal history of inflammatory bowel disease, a confirmed or suspected hereditary colorectal cancer syndrome, or any prior history of radiation to the abdomen or pelvis. People at higher risk should talk with their doctor about when screenings should begin for them. For people at average risk for colorectal cancer, they should have a colonoscopy every 10 years or a FIT test every year. Finding and removing polyps during a colonoscopy may lower the risk for colorectal cancer. When abnormal tissue or cancer is found early, it may be easier to treat. When colorectal cancer is found at an early stage, the 5-year survival rate is around 90%. For more information on colorectal cancer or colorectal screening, you can talk with your primary care physician or visit cancer.org, or you can visit one of our 2 cancer resource centers at Gibbs Cancer Center in Pelham or Gibbs Cancer Center in Spartanburg.